I mean, it was 1 hour being in the lowest of low, like, oh my gosh, what are we doing? To there's hope again. And that's what CHF gave us. Spring break of this year, our oldest son's team did a baseball tournament in Arizona. And before this spring break trip, we had been going to the doctor multiple times trying to figure out why we couldn't get over whatever it was. And we knew this Arizona trip was coming up. So the doctor had told us, hey, once we get to Arizona, it will clear up because it's different allergies there. Oklahoma is so heavy allergy centric that he just can't catch up. It's all raw and it just keeps happening with nosebleeds. So we're on our way to Arizona and he gets a nosebleed. And Dylan and I just will never forget it. We looked at each other and we're like, it wasn't just allergies, I just didn't know what.
We finally took him to the doctor and they said, hey, you need to go to an ENT and figure this whole thing out. We go to the ENT and during that time, they noticed something up there. And they said it doesn't present itself as a polyp. And I told Emily after we left that doctor's appointment that they think something's seriously wrong. And so at that point, it turned into a CT scan, an MRI, and that's when they diagnosed him with a stage 4 benign nasopharyngeal angiofibroma. Once that diagnosis happened, I mean, we were kind of spinning. We didn't really know what to do. We didn't really know how to proceed, because it's an extremely rare vascular tumor. There are less than 50 cases of it worldwide each year.
We sat there in silence for a second and I said, I think we need to post on Facebook. We need to post that we don't know what to do. So I posted on our drive home and I just said, here's our situation. I don't know how else to say it. We don't know what to do. And I kid you not, before we even got home, Jeremiah had texted us saying, hey, I know a guy.
Most people have a hard time getting in with their physician, their primary care physician, or their dentist. But we had a cell phone number and we were talking to him 30 minutes after a Facebook post. It was slated for 12 hours. They got it done in 7 hours. Dr. Dunn, Dr. Rassi, and Dr. Ramjee walked in, and in true typical Buckingham fashion, they told us, we hit a grand slam with this. And it was the coolest thing ever. You know, those guys we owe everything to. They've been godsends to us. He got out of the hospital 5 days after the surgery. We were supposed to be there for 6 to 8 weeks. I mean, he's such a strong kid. And for him to do this, just as if it was second nature, I mean, he's my hero.